Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Hi, welcome to the Get to the Root podcast. I'm your host, Dr. Paula Krupstad. And joining me today is Dr. Laura Hanson, and she is a doctor of chiropractic. Thank you for joining us today, Laura.
Thank you for having me. I'm excited to be with you.
So I'd like to give a little bit of an introduction, and I'm really looking forward to this interview because you're going to answer some questions that I've always wanted to know the answers to. And in the doctor of osteopathic medicine world, you don't necessarily get a good answer. All right. Dr. Hanson is a doctor of chiropractic medicine. She attended Palmer College and Life University with a focus in pediatrics. And we just love that. And I saw too, as I was looking through, that you also focused on pregnancy in addition to pediatrics. You can't separate the two anyway.
No, you really can't.
Yeah. And you founded Connect My Brain. You have lots of other areas you focus in, but some that are just near and dear to my heart as a functionally minded pediatrician in autism and children who are feeling awful. So I just wanted to throw out a question to you is why do you think so many children are struggling right now?
Well, that may take up the entire podcast, but we'll go from there. I've actually been working with kids for about 30 years. And us too in chiropractic, we get pediatrics, but it's really more geared towards taking a board test. And my first year out of school, I attended a seminar on pediatrics and my whole world just turned around. And then I just dove in and I started getting all kinds of different specialties in this area. And of course, it just really opens up so many doors about things that we can really look at. So, in a big picture idea, one of the things that I think is that we don't really plan our pregnancies. We plan trips, we plan to run a marathon, but we don't necessarily plan to have a baby. And over the years, the things that have really come up, especially in the world of autism, is that there's a lot of things we know now that go on in pregnancy that impact that developing brain. So in pregnancy or prior to pregnancy, we should do a functional assessment of ourselves. What's our state of health when we actually conceive alive? So that's one area that I think is really important. Then I'm sure you know this because you're in the medical field. Under the DSM, the Diagnostic Statistical Manual, pregnancy is actually listed as a disease. And so we're not even treating women something that they're innately designed to do. And it's how our healthcare system has gotten shifted and aligned itself in a particular way that you got to do this, 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 and this, rather than knowing that a woman is designed to have a baby. So, what kind of interruptions happen during pregnancy can absolutely impact how that baby's going to develop. Then the delivery process. A baby is
Yes.
meant to come out of the birth canal. And so any interruption in that, whether it be a C-section or instrumentation, no judgment. It's things that happen. In an emergency situation, I think it's fantastic that we have those tools. But oftentimes, people are planning the birth of their child and it's earlier than when the baby's actually due. Then that baby comes out. What's going on with the baby? How is the baby engaging in their world? And this is where the whole idea of sensory processing has come onto the stage.
Yes.
So What is that child doing in their environment? Are they able to be in tummy time? Are they rolling around? Are they crawling on hands and knees? Are they getting up and walking at 12 months, not at 18? Very
Yes.
frustrated that the CDC years ago, 3 or 4 years ago, changed all the developmental milestones. And crawling is not even listed anymore. And now everything is okay if it's later. And in my view, we're actually saying that developmental delay is okay.
Yes.
That's where I think there's a huge problem. And this is why I love these conversations because it's like a grassroots effort to try to educate parents that your development really does matter. It
Yes.
really is going to impact that child. And it's not just the mechanical parts of things, the subconscious mind begins the last trimester of pregnancy and continues till 7, 8.5 years old. And your subconscious runs a gazillion neurons where your conscious brain, maybe about 40. So, how you got wired up plays such a huge part. Then, of course, there's nutrition. So, I like to think about it in three columns. There is the mechanical piece. Did the child move? Did they move correctly? Did they move on time? Then there is the chemistry. What's going on inside? Like looking at MTHFR, a genetic snippet. And now today I love genomics, looking at the variants, the epigenetic things that are going on. And then, of course, it's the developing brain because you come into this world, you are fully formed, but you're not fully functioning. And you must go through these movement pieces, and you go from your lower brain to your midbrain to your higher brain. And at any time, you can get stuck. And when you get stuck, you keep growing. You don't lose the ability to grow, but you don't make the circuits that are needed for higher brain function. And, that's one of the big things in autism is that they don't prune correctly and they don't create circuits correctly.
Yes, Laura, that was a really good overall view. Just to summarize, the mechanical piece, how the baby was born, our society is so risk averse. They want to do a C-section immediately. I'm one of those people that was blessed to have two VBACs after two C-sections, which you never hear about that. The chemistry, what's going on inside mom's body and the baby's body, and then that developing brain and the influence of we know about genetics, but we know that the environment is what we bathe them in is so critical. Now, I am curious, as a chiropractor, many people describe, I would love it if you would educate me and our listening audience, especially coming from the neurological standpoint that a chiropractor looks at this and the population of children that you see. What are primitive reflexes and why do they matter?
Okay. Well, first of all, I'm so glad that you're framing my license as a chiropractor because one of the things I really, really hope over time, I think it's getting better, but I think there's still a ways to go, is bridging our professional minds for the benefit of the patient, right? So
Absolutely.
right? Yeah. And maybe some chiropractors strictly work on structure and function, but there are others like me that literally we have gone so deep into really understanding how the body works because that's the foundation of a chiropractic education is really learning the orchestration of the body. The
Mm,
spine is just one of the areas that people bring into the educational part of chiropractic because the spinal cord goes through there and every nerve that is going to go somewhere is exiting out of that spine. So, but we go through the cranium, we go through extremities, we go through the muscles, we go through the ligaments, etc. Now, to really exploring primitive reflexes, let me highlight one area of the adult body, probably an integrated body, just so that we can make the correlation. There's a muscle called the psoas, Psoas. That muscle goes from the front of the spine. It's a big muscle and it splits and then it goes one into each side of the pelvis. The mechanical part is to lift the knee, do hip flexion, but it has another role like other muscles do. And it has a role because it's been integrated into that muscle through a part of the reflexes called the withdrawal reflexes that you will always know how to defend yourself. Okay. And your peripheral vision is tied to that as well. And if you want to go into that later, we can too. But when your brain perceives a threat, the very first thing that the human body does is goes into a slight flexion in order to get that psoas muscle to shorten up in order to protect the vital organs of the body, because the brain is not sure, am I about to be stabbed, punched, or shot? Now, if that continues, if a person's brain, especially their amygdala, if they perceive so many things as threatening, that muscle will continue to stay short. And if it stays short, it's going to send a feedback message to the brain, and your brain is going to look at the world as if it's threatening. Okay, so where does that come from? It comes from primitive reflexes. So when you're a baby in the womb, you have to have something that's charging you to move. And we need babies to move because that's how they make neurological connections. So we go through a sequence of events, and this is prior to sensory motor. It's creating the ability to have sensory motor. So first, the withdrawal reflexes, your defense system. So we first learn what is it going to be in order to make sure that I am scanning my environment to know that I'm safe. Think about a baby in a womb. What's in there? Amniotic fluid? They're swirling around. There's some vibration, light touch, or any light acoustic or sound. You picking up on something and looking at it. Then you make a transition. And that word is so important because we make so many transitions in our life. We have a transition from these reflex stages, a transition from coming out in mom, out of mom, and then growing up, going to kindergarten, going to school, getting married. All those things are transitions. And that one's tied to the very first reflex called the Moro reflex. And I'll just explain one because there's a lot. So Moro is the activation of arousal, CO2O2 reflex, and the sympathetic nervous system, fight or flight. Okay, that's a big one. I call that one the enchilada because it has so much to it, right? And so arousal, does that little baby wake up rhythmically to feed? And then there is CO2O2 reflex. Now, this is an innate part of our human physiology that if we don't have enough oxygen, we are meant to take a big breath because the CO2 is climbing. And this is what's related to SIDS, sudden infant death syndrome. So an under-aroused baby may not be getting that message, and that can be life-threatening. And then sympathetics is fight or flight. Arousal patterns. If that child stays under aroused, that's like attention deficit. If that child is over aroused, attention deficit hyperactivity. And this is how you tie things back versus just putting a label on somebody and now what are you going to do with it? So there are a lot of reflexes. The asymmetrical tonic neck reflex is when the baby turns its head and the arm and leg go out on that side, and that baby is actually kicking mom. This is the kick you feel. And that is the beginning of laying down the sensory motor cortex. It's literally kicking it, saying, come on, man, wake up there. So these reflexes are about making that neurology surge, go in the direction you're meant to go in. And then, of course, they're part of the birth process. Some of them linger around for 1 year, 3 years. after the baby is born. But if they don't integrate,
I'd like to thank Fagron Genomics for sponsoring our podcast. Without knowing what your precision genetics are, you don't have a roadmap. So please log on to our website, schedule a welcome call, and see what the Wellness Blueprint can do for you. That's the premier and proprietary genetic panel that Fagron has allowed us to create.
it becomes the battle between the lower brain and the higher brain. And this is a very big reason why kids continue to struggle, because these reflexes are blocking their ability to rise up into that higher brain, because it's always tripping them up. So,
Mm.
and even, like if something happened to you and I, you actually go back to these reflexes. If you had a stroke or a heart attack, I remember when my mom had a stroke. I was working on her arm, and literally she had a palmar reflex that I thought she was going to break my finger because it's so strong. But in an adult, they'll call it a pathological reflex. But it's the rudimentary place of all learning. And if, like, I have a child who, an adult child now, but suffered a brain injury. She went back to every one of those reflexes. But it was okay because I knew what to do and get them integrated again. And she absolutely moved on. So they're there. They're a way to understand what is the neurological age in comparison to the chronological age.
Yes. Thank you so much for that explanation. And it's as you were saying, the fight, flight, freeze, or fear, seeing people stuck. I know that whenever we examine babies and we stimulate or initiate a Moreau, we're like, it's okay, it's all right. We're just kind of tracking to see where we are and looking at the fencer. You called it something different, but it's where you were saying that a baby kicks in the womb, where they turn one way and those kind of things. You alluded to this. And I appreciate you going there a little bit, but when we talk about ADD and dyslexia, they're not really the root problem, are they? They're an
No, they're not.
indication of something deeper.
Yes.
I've opined on this, but I would love to hear from you as a functionally minded chiropractor, what you see as ADD, ADHD, and dyslexia. You alluded to it with retention of some of these primitive reflexes, but go a little deeper on that for me, please.
Okay, let's start with dyslexia because, again, the DSM kind of guides what it is and what you can do about it. So it talks about that a kid would have trouble with reading and writing, and dyslexia is much more than that. But we're always giving something a name because of a symptom that we see. Dyslexia really means that the brain did not get organized. So
Mhm.
during ATNR or fencer, that's when the body is literally split right down the middle. So are both sides of the brain. And so at
Okay.
that stage, you are laying down all the neurological columns that are learning how to communicate with one another. So, for example, the right side of the brain is the big picture, the left side of the brain is the detail. We will ebb and flow between both sides, but when you're a baby, you got to lay these things down. The need to talk is on the right, the work of talk is on the left. Eventually, you're creating the timing between both sides of the brain in order to have a conversation. I always think about this one, especially with autism, because a lot of times those children are right brain dampened. So they're not really getting that drive that it would say, I need to talk.
Yes.
So if I'm dampened, I'm not getting that information. So in dyslexia, this is where you are trying to lay down those columns that'll eventually talk to each other. There's lots of columns. There's not just a couple. There's everything you're able to do. But by 4 years old, those columns should be talking to each other. And a very easy way for your audience to take a look at their own little person, I call it the lateralization test. By 4, you should declare dominance, meaning you should have a dominant eye, a dominant ear, a dominant hand, and a dominant foot. So I share this all the time. Set up a little table, take a paper towel roll with no paper, have your child pick it up, watch the hand that they pick it up with, and which eye do they put it to. Tell them you're going to be a pirate. Look down the column there. And then
Yes.
you may already know what hand they use to color, but go ahead and get them because you want to also watch how do they hold that crayon? Do they wrap
Yes.
their hands around? That would be a palmar reflex, or are they able to get into a pincer grip? Okay. And then
Yes.
how do they navigate the paper? Do they have to get their body into a new posture just to be able to write? Or can they execute something on the paper? And then use a phone, have them put it up to their ear, and then roll a ball and have them kick it. All of that should be on one side. That would give you an idea that my child's brain got organized. Remember what we said before, we're looking at the neurological age versus and how does it match the chronological age? So let's say I had a 5-year-old that had mixed laterality, then I could know this happened before they were 4. Let's
Mhm.
say that same child is completely dominant on one side, but still struggling, regardless of the age that you do the little test. I know from 4 behind, you probably got wired up right. So we can now go look at other things that are about the timing or about the
Yes.
chemistry or about the brain. So I love neuro and biofeedback. I do a lot of brain mapping. Dyslexia will actually come up on the report if the brain waves match that pattern. So it
Yes.
could just be one side of the brain, especially on the left. That's your letterbox area. We actually don't have a place in our brain that says, because of this, I can read. It's actually called a letterbox. And it's
Mhm.
how we teach children to recognize what a letter looks like, what does it mean, how do you say it, etc. So I find that typically when the left side, especially front temporal, is downregulated, then we have trouble with speech, we have trouble writing, we have trouble recognizing. And that's another reason why I love neuro and biofeedback because it's part of the equation, mechanical chemical brain. We can go in there and work on the brain. We can find
Yes.
the brain waves that are too low, too high, disorganized, and the child can begin to practice the correct pattern, and you get real time data after that. So, dyslexia has a lot to do with organization of the brain. Attention deficit, whether it's just attention deficit or hyperactivity, there's typically too many slow waves in the front. And that, again, is also about organization. So, what is going on that's making this brain go in this pattern? Just like what you were saying, what's the root? So, I realize we got a name for it, but I'm always asking that question, but why?
Yes.
You are innately designed to be able to pay attention. You are innately designed to become organized. What is blocking you? What interfered for you. And it can be mechanical, and it can be chemistry, and it can be brain, it can be all of them together, and it can be one over the other. I see kids that I will tell the parent, "Your child is incredibly coordinated, but their chemistry is so off." Like kids that have chronic strep infections, kids that have dysbiosis of the gut. All of
Correct.
those things can impact that gut brain axis and inhibit performance.
Yeah. At the very beginning, you said that the CDC several years ago changed our developmental milestones, and that just infuriated me as a board certified pediatrician that was in the middle of COVID. It's like we're going to dumb everybody down because we have so many toxins and things in our environment. And when you look at, and I appreciated so much what you were saying is it's okay, we've got the mechanical, the chemistry, and the developing brain, putting it all together and giving parents the ability to know, especially that this mama who is deciding, well, a pre-mama, I'm getting ready to get pregnant. What are the things that I can do? So I'm going to toss the toxins, eat a good clean diet, make sure I'm taking care of me. That's exactly, Laura, what you were implying too. It's like this beautiful system that our bodies are innately designed to do. Now, let me pop in with a few other things. Oh, yeah, why do so many traditional approaches fail to create a lasting change?
Well, unfortunately, that's our healthcare system. And I
Yes.
do see a few lights at the end of the tunnel that we are, at least now we can talk about things, right? For years, and I've even had parents say to me, you know, when you ask a parent, do you have any idea what happened to your child? Why did they regress? Some of them will pinpoint vaccines very, very quickly. Others will say they really don't know. I feel like that topic has been very difficult for us to be able just to discuss. I appreciate the attitude of you should have a right to do with your body what you want to do. And so when somebody wants to do that, support you 150%. But if you don't wanna do that, I support you 150%. So I think that's a big part of things is we have to be able to talk about it. And
Mm,
sometimes I really don't understand why we can't. And if there's a problem, why don't we bring it to a discussion and see what we can do better? You know,
yes.
I got very infuriated as well last year when red dye was finally beginning to be pushed back. And they've known for over 30 years
Yes.
the effect of it and how many people have been impacted. And I think that's my poor little heartstrings get tied into that kind of stuff that, if we need to do something different, then let's just do differently. And I think our healthcare system, I think it needs an overhaul. I think we need to listen to parents. I've heard parents being fired from a pediatrician. I've
Yes.
heard that they don't feel like, oh my gosh, my pediatrician's just going to be so mad at me if I don't do this. And I don't think anybody should ever feel that way. You're
Agreed.
going for help.
Yeah.
I have experienced, especially when my daughter had a brain injury, I wanted to do many functional things, and I had to go through her neurologist, and I always spoke to the PA, and she literally said to me, she goes, "How do you know to do all this stuff?" And I go, "I don't know how you don't." I go, This is a recovering brain. The sky's the limit. She's
Right.
16."
Right.
And we've just I think we've gotta get more outside of the box, and we have to take some of these new things, like, I find genomic testing just
Mm,
absolutely fascinating, and it really matches these children. So,
yes.
if you don't know what that is, just for your audience, it's a saliva test, so it's super easy to do on kids, and it literally is gonna tell you what that ancestral line is as well as epigenetics. And it tells you what supplements, what lifestyles, what medications, and it's personalized healthcare. And so I guess that's what I really think we need more of is personalized healthcare. What may work for one person may not work for another. There's a marker on that genomic test. It's a pie chart. And it shows you where if you have a double hit of a particular snippet, you might be a sliver of the pie where part of the population is over here and then the rest of the population doesn't have it. But they will recommend for this for the greater population and not take into consideration the person with the sliver. And this is what I think we got to know is the uniqueness of an individual and personalize whatever it is that we're doing for them.
You know, Laura, I'm so glad you brought that up because that is the root of my practice. In almost 11 years of functional practice, we've only had 3 children diagnosed with autism during that time. And those were people who had not applied precision genetics because we have people who come to us with vaccine injured children or having been fired, just as you brought up. And a lot of the things that we look into are non-epigenetically modifiable genes, meaning that you get what you get, you don't throw a fit, but we know that environment influences everything. Everything is influenced. But if you lack an enzyme that helps with brain regeneration or the gut-brain connection and neurotropic factors and inflammation and mitochondria and detoxification, just as you're alluding to, without that biochemical piece mixed in with the mechanical and then integrating everything, that the brain can't get back on track. Now, you basically, in a nutshell, just delivered what we love to hear here. And we have this group of chiropractors we have around our area that do a lot of the EEGs and neurofeedback. So we have
Great.
some folks local, which is just awesome to have. But what do parents typically say when they finally understand what's going on with their child to you?
Most of the time, I think the number one thing that I hear is, gosh, that just makes so much sense.
Uh,
And I love that because I feel like then I call it a gamma burst. Gamma is your aha moment when like the light bulb goes off in your head. And I feel like they're having one right in front of me that we simplify it and we give them hope and we give them a path and we have check-ins. We are always checking in on our progress so that we can get them through a program because the goal is not to keep you here for the rest of your life, but rather, I get a lot of kiddos that parents have tried all the traditional approaches and they didn't work. And they've got like, I got one more try in me. And that's what I like to tell them is that we want this to be the last place that you come to, that
yes.
we're going to put it together. It's going to be some work, but if you will put these things together the way the human body works, results are inevitable. And that's what we really like to see for the child, for the parent, for the family. Because, trying to drive around here in Atlanta, going from one place to another can be very frustrating.
Yes, yes, same with Houston. So I hear you saying this, but the question that parents ask, is can the brain really change even if the child is older? And you alluded to when your own daughter had a
That's
brain
right.
injury at 16. Unpack that hope of what all that looks like, especially at your practice, Connect My Brain.
Well, this was it's going to be 10 years in about 2 weeks. So May 11th, 2016. I
Congratulations.
Thank you. Yeah, it's great. It really is. My adorable 16-year-old feisty little girl was on her way to work and she made a left-hand turn out of our neighborhood
Mm.
and she was T-boned on the side. And it was the airbags, the way they boxed her brain. She didn't have any broken bones. She had one cut on the back of her arm that was this big, didn't even need a stitch, but it was all brain. And when I got to the hospital, I thought maybe she had broken her neck. That's the first thought that I had.
Oh,
And the ER doctor came in, and, I just wanted to see my daughter, and everybody from the neighborhood had piled into the hospital. there had been let me back up 1 second to give you an idea of the intensity. So, in medicine, there is many ways that first responders speak to each other in an abbreviated form, and this one's called the Glasgow Coma Scale, and it goes from 3 to 15. 15 is
Uh-huh.
a mild traumatic brain injury, 3 is brain dead. When they picked up my daughter, they gave her an 8. By the time she got to the
My.
hospital, she was a 4. She was dying, and I didn't know that piece in that moment. So when the ER doctor came in and I said, "I really wanna see my daughter," she said, "No, we're waiting for the neurologist." And I fell off my chair because she said, "Your daughter has a brain injury, and there are so many brain bleeds, we can't count them." And
My
I
gosh.
I I
Oh,
just I literally fell off my chair. And then after that and she was very cold, very cold. And then this one nurse came in and she goes, "You need to go see your daughter." And I remember asking her, "Is she dying? Is she dead? What's going on?" And she goes, I don't know. I don't know." So they let me go in the room, and she was lying on a gurney, a steel gurney. They had cut her clothes, and she was on life support and lifeless, just completely lifeless. And
poor.
it was kind of like a hand inventory just to kind of see. And then they started to need X-ray and made me leave the room. And all of a sudden, I got this headache. This will bring at least a little laughter into the conversation. I think I was feeling her pain. It was so bad that I asked for some kind of pain reliever, but they offered me Tylenol, and I said, "Oh, no, no, no. That's a glutathione disruptor. I don't want glut."
Yes.
These people were probably looking at me like, "What is she talking about?" So I got
Right.
Advil. Okay.
Yes.
So then she was in ICU. She was in ICU for 30 days. The first 12 days, she didn't wake up. She was in a non-induced coma. They did sedation vacation. The accident happened on a Wednesday. Saturday, they did sedation vacation, and she didn't wake up, and that's when I really knew that it was real. The night of the accident, they drilled a hole in her head to release the pressure. At least we didn't have to have a piece of her cranium removed.
Oh.
And then on the 12th day, they decided to do a tracheotomy. After that is when my daughter started to wake up. But she
Oh.
was in ICU for 30 days and really not doing much. She could look at us, but she wasn't talking. She wasn't moving anything. And they thought she had actually had a stroke, but she didn't. Then, after a month, we moved to CHOA, and that's when they started doing rehab. I closed my CHOA is Children's Healthcare of Atlanta.
Okay. Okay.
I actually closed my practice back then, and I brought my therapies over to her hospital room so that when she was done with them, she had to work with me. And she had to relearn how to walk, talk, eat, toilet, dress herself. And it took 2.5 years. And
Oh,
it probably the biggest experience I've ever had in my life. I'm grateful because I also felt what other parents feel.
yes.
And it kinda changed my dynamics, you know? But I finally went back into practice in 2019. I remember looking around and just going, "God, you prepared me for this." The
Yes.
work that I do, I was doing prior to this, and we just put it into action. And it was a lot of work, it really was. It was a lot of supplements, it was completely changing diets and going from one therapy to another a lot and taking chances because when she was released out of CHOA, you typically go into day rehab because she wasn't stable yet. And I remember feeling very disappointed by that. That was a $1,200 a day experience, and they weren't doing anything with her. They had her doing finger yarn, and I remember them having this treadmill that you wear pants, and it has a camera at the bottom so you can see your legs up on the monitor. Those things are so powerful for the brain. She was a runner before this happened, and they only let her do this treadmill one time, And I would go into meetings with research and say, come on. And I did. I started taking chances. I then tried to put her into Shepherd's, which is another big brain place here in Atlanta. But when we went for the tour, it scared her because it was just people laying around and she was
Yes.
walking around. That wasn't her. So in chiropractic, we've got a neurological center right on campus. And I just said, you know what? This is where we're going. And that was the smartest thing we ever did. And I have a great colleague that was just her provider at the time. And we did things called a gyrostem. Gyrostem was created by an engineer whose daughter had cerebral palsy. And he went to the doctor with his daughter, and they said, your daughter needs vestibular work. And as an engineer, he's like going, okay, what's that? How do I do it? He took her car seat and put giant wheels on it and would just roll her through the house.
Yes.
Brilliant.
Yes.
Brilliant. But it led him to create the gyrostem, which is this giant capsule, looks like you're headed to the moon, but you get strapped into a seat and you move. And, we started very ginger, but I can tell you, these things were instrumental. And my daughter went to college and graduated magna cum laude from the University of Georgia.
Oh,
If you met, we did everything that we know to do. Even on her trach hole, you know how so many people look like they have a vacuum. Well, she was 16, so I was like, we got to preserve some stuff here. And we did high pH water. We did aloe. We worked on her where she got the hole drilled into her head. We were so functional. And if you met her today, you wouldn't even know she went through this.
beautiful.
2.5 years, but the brain can absolutely change. And I have another really good colleague that is a medical doctor, and he's all functional. He actually brought over a jump drive to the neurologist. He wanted him to infuse phosphatidylcholine into her IV. And he gave him like hundreds of articles, and the neurologist did nothing with it. But once
Yes.
we got over to CHOA, I set up a kitchen. I had another great friend who was making her homemade kefir and bone broth, and I was just taking care of her. And I
Yes.
I do believe I do believe that the efforts of all the people that showered us during that time is the whole reason why today my daughter is great. She's completely independent. She drives. I'd rather she wear bubble wrap when she drives, but you know,
Yes.
you can't
Yeah.
hold them back all the time, but she's 26 years old. She's doing great. She's been interviewing for a really, really big position. We're really hopeful for her. But you know, if there's anything I could leave with your audience is don't stop. There is
Yes.
a reason. And don't let a label become like your name tag.
Yes.
Find out, dig. It's worth it.
Yeah. The experience that you went through with your daughter, first of all, I'm so grateful to hear that she's thriving and doing
Yes.
so well with all the modalities that were used to restore her to health. And
Yes.
then the compassion that you as a provider, you understand where parents come to you and they're
Yeah.
like, can my child's brain recover? Can it change? Absolutely.
Absolutely.
And I sure hope that you were able to give her phosphatidylcholine at least
All the
orally
time. I
when you
was
got out. Yeah, it's like, "Here."
tablespoons of it.
Yes, yes. I mean, the documentation. Now, if someone wants to, again, thanks for sharing that. It's the integration of all of those things. And, when I think about traumatic brain injuries, about flooding the area with omega-3 fatty acids in the right ratio and lowering the glutamate and using N-acetyl-L-cysteine to shift over from that excitatory quinolinic and kynurenic acid pathway over into calm and keep the dopamine in the synapses. You're speaking our language, Laura.
Yeah.
You really, really are. So, for families that are listening today and this resonates with them, and how can they find you and about your program, Connect My Brain?
Well, I have to tell you, they've been pushing me to call it now Connect My Child's Brain.
Okay.
We're not changing our website and all of that at this point in time, but everything about us is called Connect My Brain. And I have an app as well. That's called Connect My Brain because after the CDC did that, I was like, man, we got to get this information out there. So I put an app together that lets you know when your child should be doing what. So that's one thing. Everything is called Connect My Brain. Second of all, go to the website, connectmybrain.com, and just fill out a form. And I am the one that always follows up. I love chatting with parents. You're welcome to call the office. The number here is 678 501 51. And we do work remotely. We've got many different strategies for many different types of families. And that's one of the things that we try to do is meet you where you are.
Beautiful, beautiful. Laura, thank you so much for being a guest today. And everyone, let's thank Dr. Laura Hanson. What a wealth of experience and your personal story with your daughter really, that really connects you to the audience. And it's what we say here at my practice, it's hope for healing. And like you said, there's always hope. And that's what we
Always.
want to infuse people with. So if you had one last thing that you wanted to say to the audience as they listen, what would that be?
Take the time to do something for yourself, as well as never lose hope and always know there is a reason why things aren't going the right way. And if you uncover it, you go a better way.
Thank you so much.
Thank you.
Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it, and leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.